Hi, my name's Bruno Silva. I'm one of the dentists at Brighton Implant Clinic. Today we're talking about complications that can arise around all-on-4 dental implants. This can also apply to other types of dental implants, even single tooth implants. We are going to show you later on within the video the actual surgery of what we've had to do for this particular case. So with an all-on-4, traditionally you have 4 implants. You can have sometimes 5 or 6 implants if there is sufficient bone or there was enough space to place more implants, but traditionally you'd have a minimum of 4 implants. A fixed bridge is actually attached to those 4 implants. After the treatment's been finished, it's really important that regular maintenance of the bridge is done. We recommend once a year to go to your dentist to have the bridge removed. It's important that your dentist is familiar with how to remove the all-on-4 bridge and how to carry out maintenance. Sometimes what can happen is that one of the implants can become infected. First we see like bone loss around the implant, and what that effectively means is that we start losing the support around the implant, and the implant, it has some small threads around it that basically the dentist is used to actually engage into the jawbone. Now, if we start losing bone around the implant, that surface of implant, which is a little bit rough, it's like a very smooth type sandpaper surface. It's been made that way intentionally so that bone can stick to it. But if the bone starts to shrink around the implant, then that rough surface starts to become exposed. Okay, it might be kind of buried within the gum tissue, but what effectively happens is that bacteria can actually track down the gum tissue and eventually contaminate that rough surface. And once bacteria contaminate that rough surface, it can be quite difficult to remove them. Like, we do have bacteria in our mouth at all times. These are good bacteria, normal bacteria, so it's normal, but there are certain bacteria that can particularly cause problems around implants. So as the bone loss becomes worse, these bacteria are stuck to the surface of the implant and they start to produce infection, and in turn they cause further bone loss. And the symptoms that you would be seeing if you were to have this, you might have some tenderness around an implant, you might have some like bleeding, or if you press the area it might be uncomfortable. These are all signs of like an infection around an implant. This is also called peri-implantitis, which is something that as implant dentists we're starting to see more and more frequently as more and more patients start having implants. So in this particular case, a gentleman that had the all-on-4 treatment carried out with us almost 12 years ago, he came to see us recently because he had problems around one of the implants. And when we looked at the x-ray, when we looked inside his mouth, we could see that there was an issue with one of the implants on the upper right side. So the decision was made that because the bone loss is quite extensive, we actually opted to remove the implant altogether. Okay, so just looking at this x-ray, you can see this is called a panoramic x-ray. This is the upper jaw over here. You can see the 4 implants. You can see this over here, gray area. This is the level of bone around the implants. The lower jaw, you can see here, gray area. This is the actual bone that's holding the teeth in place. So with the upper jaw, you can see 4 implants, and the image is inverted because it's an x-ray. So you can see this is the right side. On the right side, we can see the bone here, it's all horizontal, okay, but then over here it actually goes up quite substantially. You can see this area here is basically like outside bone. And there are also some problems going on in the lower jaw. You can see he has 2 bridges on the lower jaw, and if we look at the roots of each of these teeth, we can see that around this root there's like a dark shadow, and that indicates some lesion or chronic infection around this root and also around this root. Also, if we look at the x-ray, you can see the bone here, it's kind of goes up and down in between the teeth, and that's a sign of bone loss around the natural teeth, usually as a consequence of gum disease. So this is the implant that we're going to be removing today. We're going to wait for this area to heal, and then hopefully in this vicinity we'll be able to place another implant in the near future. It can be difficult to actually carry out some of these alternative newer methods or newer treatments to try and reduce bone loss or try to make the bone grow back again. But in many cases we actually opt to remove the implant. We have to wait for the bone to heal, and then after a 3 to 4 months healing period, usually we can go back and we can place an implant again. The All-on-4 would then be kind of reconstituted, so it would be back to how it was previously, and a new bridge would be made on the 4 implants, with the new position being kind of the new implant that's been placed. The video does involve some surgery, so if you are interested in seeing, carry on, you would prefer not to see a procedure, then just disconnect now. Alright, thank you very much. If you do have any questions, post your comments below. Please visit us at www.brightonimplantclinic.co.uk. Many thanks. Cheers. Bye-bye.